Good afternoon, everyone. My name is Angela Brand, and I'm with NAMI California, and I'd like to welcome you to our event this afternoon, which is the town hall conversation that we'll be having with Department of Healthcare Services and our special guest, Dr. Jim Cooler. Before we get started, I just want to thank everyone for taking the time to join us today. There's a lot going on right now in the world between what we've all been sort of experiencing and living through with COVID-19, as well as what's been happening over the last days and week with the issues surrounding George Floyd and Breonna Taylor and Ahmaud Arbery and, all of the others that just the heaviness of what's going on in our world around, racial inequality and social justice. And so having you here with us today to participate in the conversation from wherever you are across the state and, the experiences and the personal issues that are touching you and touching your families. I'm really grateful that you chose to take some time this afternoon to join us and just wanted to acknowledge kind of where we're at with this. So thank you. We'll go ahead and get started. We're going to go through a couple of housekeeping things. I wanted to let you know that you're joined not just by myself, but we also have our CEO, Jessica Cruz, our COO, Stephen Kite, and then two members of our NAMI team, Brianna Vargas and Ragini Lal, who are our sort of producers for this event, and they're running all of the back-end support. They're helping with the Q&A, they're facilitating this digital platform, so I don't have to mess with webcams and buttons and all of those things. And so I just wanted to let you know that our team is here in full force to support this effort. We'll run through a couple of housekeeping things before we get started on our conversation. I'm going to turn it over to Ragini to give you some information on this platform and how to facilitate raising your hand and using the chat box, and to go over a polling feature that we'll be using for this conversation. So go ahead, Ragini.
Thank you, Angela. I'm hoping everyone can hear us. If you can, please definitely express that into your questions chat box. So, and then Brianna said that she would be able to kind of answer any questions or anything on the chat box. Let's get started, and thank you everyone for being here. I just want to go over some quick little technical things that you can use while we're going through this webinar. So later on, we're going to have a Q&A session, and then you can obviously, as you know, you can use the question chat box that you see in your panel, your GoToWebinar panel, but then you can also use your hand raising sign right here. If you click this button, it lets us know that you want to speak verbally. So right here is your speaker sign, and it's muted. So right now, everyone's muted on our end, and then once you raise your hand, and Brianna and I would be able to see that you raised your hand, and then we'll call out your name and then unmute you, and you got to make sure you're unmuted on your end as well to speak and to answer and to ask a question or make a statement. If you have any questions, continue asking, and if you want me to clarify again, please let us know. We also would be using polling throughout this webinar. We want to make this as interactive as possible and get to hear as much as we can from you in our short 1 hour and a half that we have with you. So one of the ways to do that that we're using is Mentimeter. So what you use easily, it's pretty easy. You can either pull out your phone and go to your Google or your Internet Explorer on your phone and go to www.menti.com. It says right here, it's very light. I'm sorry you can't see that. And then use the code 8462. I'm going to put that into the questions box so you know what the code is. And it's a really great, simple, and kind of fun way to participate throughout the webinar. Here's a visual of how it looks like on a phone. I personally like to use the phone so I can focus on whatever's on my screen, whatever's being presented, but then also have my phone to kind of participate, and it's kind of fun. So again, this is more bold and easier to see. So it says www.menti.com, and then it'll take you to this little screen right here. It says 8462 at the top. Again, I'll put this code into the chat box so you can always refer back to it to participate. And then anytime polling questions come up, the slides will have this top part right here, this instruction part right here. Hopefully you can see that. That's it. If anyone has any questions, please ask them in the questions and chat box, and I'm going to hand it back over to Angela.
Thank you, Ragini. So I just wanted to start our conversation today by going over our house rules. Some community agreements that we've incorporated into a lot of these online discussions. The first is be kind and be courteous. Listen attentively and with an open mind. Speak honestly. Share the space. Learning leaves, but names stay. We ask that you step up and step back. And lastly, to reserve the right to change your mind. And as a reminder, this webinar is being recorded and will be shared after with interested parties, including the folks that are here participating today. If you have any questions or concerns, again, please utilize the chat box. Our staff is happy to help with anything around these house rules. And as we get started, I'd like to introduce our CEO of NAMI California, Jessica Cruz.
Thank you, Angela, and I'm so excited to have our second town hall where we are bringing some state leaders to our NAMI members, really to connect the two state organizations with our local members so that we can have a true conversation. You guys can hear from our state leaders what they're working on, and also be able to provide your voice and an opportunity for you to share what might be needed in your local community so that the leaders within the state can develop policies and some procedures and making sure that families and individuals who are impacted by serious mental illness throughout the state are able to get the services and supports that they need. And at the state office, we do a lot of work with these partners. And as COVID happened and we were able to kind of put together these virtual meetings, we started to really think about who needed to connect with our members. And through our conversations that we have with our state partners, whether it was CBHDA, the County Behavioral Health Directors Association that we had on last time, or now the Department of Healthcare Services that we're here today. So I'm so excited to introduce Dr. Jim Kohler, who serves as the Assistant Deputy Director of Behavioral Health of California for the Department of Healthcare Services. And Jim, in his role, he's responsible for leading policy efforts to see specifically that youth services are receiving behavioral health throughout California. He previously served as an administrator for the California Friday Night Live Partnership and the California Center for Youth Development and Health Promotion. He has designed and implemented and been the brain behind several programs and pioneering various different Friday Night Live, Club Live, the Friday Night Live Kids and mentoring programs. He even has sat with the governor of California's mentorship program and helped them initiate the mentorship program. So we're so excited that he's joined Department of Healthcare Services, not only from his past experience of working with youth and families, but also his experience in working in the behavioral health realm. And so we're so pleased to have you here with us, Jim, and we'll move it on to you. So thank you.
Well, Jessica, thank you so much. I wish my mom had been here to hear that. That was really nice. And I apologize that my camera is not working. It's spinning, and I will sit still, and hopefully it will catch up with me at some point. But thank you to NAMI, to Jessica, to Angela for the invitation and the opportunity to be involved and to participate and share with you. And as Angela mentioned, it's a really dark time right now between COVID and the social injustices happening. It weighs heavy on all of us, and trying to speak openly and truthfully about what's happening and how we are feeling, and trying to gain some cultural humility and this pandemic of sadness, of stress, anxiety, and depression is likely to lead to a larger number of deaths of despair, and we would like to step in front of that. So Ragini, I think I'm just going to have to let you know it's time for the next slide, since I don't think you can see me. Thank you. So the Department of Health Services is a little bit like the mothership, the USS Enterprise. And this is a nice enterprise, but it doesn't really exist. But there's another one on the next slide, which is the actual USS Enterprise. And the next slide shows you the actual battleship. And this aircraft carrier is a bit like DHCS. It has a lot of tools. It helps protect the community. And it doesn't turn very well. It's a big ship and it goes in one direction pretty swiftly, but changing directions are challenging for us. So when we think about what we can do and the supports that we can provide folks, there's a story that's similar regarding the USS Enterprise, and it was out along the coast on a really foggy night, and they were still using signals, the flashing lights, to communicate with other ships. And they came upon another ship and they blinked back and forth, and the USS Enterprise says, you know, we're coming your direction, we don't turn that well, and you need to move out of the way so we don't collide. And the flash came back, says, well, interesting, but you all really need to change direction. And the Enterprise flashes back one more time and says, you know, we are a nuclear aircraft carrier. We're big, we're strong, you have to move. And if we go to the next slide, we see that that next flash was coming from the lighthouse. And the lighthouse says, really, you're the one who needs to change direction. And that's what you all are for us. You're the lighthouse that helps give us direction on where we should be headed and the kinds of supports that we can provide you that make a difference. While we may have a lot of resources, it takes the community to really help us know where we should be headed. And what I'd like to do today with the next slide, and I've been in my position just since January, is I'd like to institute an AFZ, an acronym-free zone. I have been faced with more acronyms than I possibly could have ever learned, and I still have not learned them all. So today, as best I can, I will try and speak and give you the full word and then the acronym behind that. So as we go forward and think about some of the things that we can do, one of the areas that we're working on is our foster care model of care work group. If you've been involved with the CalAIM process at all, and that's the Advancing Innovations in Medicaid, we've taken a look at a lot of things, but one of the things that was missing was working with the youth in the foster care system. So there is now a work group that's doing just that. And with the change in our economic status in California, having started the year with a January budget with a $6 billion surplus and a May revise coming out with a $50 billion deficit, the CalAIM work has been delayed for a year. Now, that's bad news for the CalAIM efforts, but it's good news in some ways for the foster care movement, who will now be able to be in alignment with the larger innovations that we're putting forward. So at the end of this month will be the first meeting, and it's really to take a look at how could we do a better job of serving our young people in the foster care system. It's particularly difficult for them when they move from one county to another, and services tend not to follow them smoothly. So we're trying to take a look at how could a new system of care assist with that, and providing them the kind of behavioral health supports that they desperately need. And in this pandemic and this isolation, young people have been hit particularly hard. Young people need that sense of connection as much or more than we adults do. And young people in the foster care system are already really isolated. Adding this additional personal separation and isolation has been incredibly hard for them. So we're looking to see what we could do. And going to our next slide, we'll take a look at our behavioral health task force. So at the Health and Human Services Agency, Governor Newsom pulled together a behavioral health task force of professionals to take a look at the mental health and substance use disorder needs all over California. And this is across agencies. This isn't just the Department of Healthcare Services or Social Services, but this covers all of the 11 departments and the 6 offices within the Health and Human Services Agency. So if you have interest in what they're doing, the email address is there. And I believe we'll be able to post this set of slides for you at the end. So you'll have these links that can give you more information. And going to the next area, what we'll find is that we're going to do a survey. This is so cool. So let's see if we got this right. So you're going to go to your phone now. You're going to open up a browser to menti.com and put in the code 8462, and you're going to respond if you know someone that's been sick or tested positive from COVID. So we'll give you a moment to fill that out. So it looks like almost half of us have had a personal experience with someone who's been sick or tested positive. I know for myself, I have a niece who is a nurse who was providing healthcare services in a COVID unit, and unfortunately, she too became infected and ill, and much to our distress was laid off without support of the hospital that she was working with. So there are many stories of people who've been impacted, and the stressors that are related to COVID are not just about our own personal health or the health of someone, but let's go to the next slide. So a little over a third of us know someone, but this question, similar, talks about, has your employment been affected by COVID or somebody you know? So while the physical health issues had an impact, the unintended consequence of the personal separation and businesses not being able to operate create a high level of stress and anxiety around our employment. And if our employment is uncertain, think about the other things that become uncertain. All of our issues around housing, around food availability. So the one pandemic that started as a health issue morphed into an economic pandemic that will take us a significant amount of time to get out of. So 80% of us have had affected as a result of COVID-19. Let's go to the next slide. So one of the things that we are implementing to try and support people who are feeling the stress and anxiety or depression as a result of COVID-19 or the other unintended consequences is what's called the Crisis Counseling Program. And there are two phases to that. The first of that is the Immediate Services Program. When FEMA and SAMHSA, FEMA, the Federal Emergency Management Agency, and SAMHSA, the Substance Abuse and Mental Health Services Administration, talk about a crisis counseling program, the term counseling is used somewhat liberally. The people that we look to serve as a crisis counselor don't necessarily have to be someone who is licensed or certified. It's someone who may be a peer, have lived experience, and then go through a training so that they become good at listening and connecting people to supports and services they need. So it's not addressing diagnosable mental illness issues. It's about connecting them to services that might be able to help them. So California applied for the Immediate Services Program and was awarded $1.6 million from FEMA to relaunch CalHOPE. And CalHOPE was the campaign that was put in place for Butte County when the Camp Fire disaster happened. And the Immediate Services Program is really intended to be for the 60 days after the declaration of an emergency. In this case, we are focusing on a media campaign, and that media campaign is really to help normalize and help people understand that what you're feeling around the stress and anxiety is really normal. Anyone in these kinds of situations would feel that way. And if you want to talk to somebody, we've worked with the San Francisco Warm Line to expand their services to be able to address issues coming from COVID-19. We've also taken a look at the CalHOPE website. So if you were to go to calhope.dhcs.ca.gov, you will see a website that is, yes, only 2 days old. Yeah, we just were able to put it up, and it's a very basic website that makes some connections to other resources. And then the warm line, the CalHOPE warm line, operated by the Peer Warm Line in San Francisco, is reachable at the 833-317-HOPE or 4673. So the idea is that this is the first wave, and we believe that even the media in itself is an intervention. And the goal of the crisis counseling program is to support people and help them get the support they need at the lowest level without having to escalate and need services that are more costly, more intensive, and more invasive. So really looking to meet people where they are and assist them in addressing what they're faced with. And if we go to the next slide, we can talk a bit about what follows that, which is the regular services program. And that expands the initial immediate service program, which was 60 days, to more of a 9-month program. We have an application that's been submitted to FEMA, and it's under review now. But our proposal to them is for $84 million to be able to ramp a much larger statewide effort. Because in most cases, when FEMA would think about a disaster and put the crisis counseling program in place, it is something like an earthquake that lasts a matter of seconds, or it's a fire that might last a number of days. And when that incident is over, you can go and physically find the people who've been impacted and assist them in getting help. This pandemic and this disaster of COVID-19 is unlike any of those types of disasters. It has hit every community in California, and it didn't just come and go in a matter of seconds or days. It goes on today as well. And the idea of putting someone in a wonderful t-shirt from FEMA that says, "I'm here to help," to go out to find people standing in front of their burned out home just doesn't work. So we're learning more about telemedicine and telehealth, and we're designing a statewide intervention for crisis counseling that is based on that type of model. So we'll be looking to expand our media campaign that will not only reach the general public, but also focus on some high-risk populations. And then also to expand the CalHOPE website to be much more human-centered, because the state is really good at developing really bad websites. We have pages upon pages that have too many phone numbers and too many links, and no one knows which one to choose. So we're working with UCLA to create a much more human-centered approach, and working with communities to help us develop almost avatars to guide you through the web page to find the resource that's most appropriate for you. So those are the kinds of advancements we're trying to put in place with the regular services program. And the next slide, I think, gives us a little bit of more information. In addition to what we've talked about so far, we're talking about a CalHOPE support effort. So expanding the CalHOPE warm line to 24/7, whereas now it goes from 7 in the morning until 11 o'clock at night. And after that time or outside of those hours, it rolls to the disaster distress line or the regular warm line services. So we're looking to expand the CalHOPE warm line to 24/7. And then we also want to have another service to provide almost an EAP, an employee assistance type of program, where a person could have up to 6 sessions with someone, with a crisis counselor who is similar in background and similar in experiences, to help them again get connected. In addition, have a specific contract for tribal crisis counseling because too often we miss supporting the tribal communities. And then also taking a look at our young people and coming up with a CalHOPE school intervention to provide communities of practice where schools who for the first time have had to go to a complete distance learning model and young people being at home. And if any of you are parents with young people who have had to be teachers while being parents, while being employed, you know how stressful that is and how difficult it has been. And now as we go through the summer and we think about having our young people transition back to school, they may be able to come back for a certain amount of time under different circumstances. And if we get another spike, they may have to go back to distance learning. So we anticipate a high level of stress for parents, for students, and for faculty in this new world that we're living in, trying to figure out how to navigate the COVID-19 issues. So those are the elements. And then graphically, I think our next slide kind of lays that out for us and lets us take a look at how these build upon each other. So our CalHOPE media is the community-wide base that we think is the first intervention. And some people may feel better by seeing a PSA that says this is normal. And that may be adequate for them to accept how they're feeling and be okay. We'll also be expanding again to specific populations and using different mediums to reach different populations. So for example, in the Central Valley, if we're trying to reach Hispanic populations, we'd be using much more radio than we'd be using television. So using the experts in social media and media to help us reach populations that we normally wouldn't be able to do. The next is our CalHOPE web, and then making sure that we have good resources and linkages and applications, things around mindfulness and other ways in which people can again help themselves. If that intervention doesn't work, then we go to the CalHOPE Pure Warm line. And the warm line, again, being that opportunity to connect with a live person who has lived experiences, who can help you solve and connect to some of the resources you might need. If that one contact isn't enough, then going to CalHOPE support, where they might get up to 6 sessions with someone who looks like them, sounds like them, having American Indian and Native Alaskan contract to support them, and then the school-based services. And if those services aren't enough, then a warm handoff to the actual treatment services. So the entire CalHOPE program of the crisis counseling effort is really looking to normalize the stress and anxiety and assist people who are feeling out of sorts because of their physical isolation, their health issues, or the economic uncertainties. And ultimately, our goal is to prevent a wave of deaths of despair. And we can't do this without your help. And that's where, again, going back to that lighthouse, where you're guiding us and you're giving us feedback on what's working. So as we ramp up the CalHOPE program, we hope that you and your local partners will be truly partners in assisting us in making sure that people get connected. So if we go to our next slide, it's time, yes, for another survey. So this is a chance just to write, finishing the sentence, sheltering at home has been traumatic, difficult, but okay, or a nice break. So where do you land? I know for me, it's actually been a nice break from the commute. I live in Modesto and our offices are in Sacramento. So I'm speaking to you today from the Modesto office of the Department of Healthcare Services. So not having to drive has been really nice. Unfortunately, I found, and maybe you have as well, is that it hasn't created the time that I saved in commuting, hasn't translated into any free time. The days are actually longer and there are more demands on us as we go through this. So for some folks, it's been traumatic, difficult for most people, manageable, okay for some, and only a couple for whom it's been nice. So for those that it's been traumatic or it's been difficult, CalHOPE is here, and I encourage you to give it a try and tell us whether it is a resource that provides any support and help to you. So thank you for participating in the mentee poll. Let's go to our next slide. Now we get to do a word cloud. This is fun. So you get to complete the sentence. Because of COVID-19, I am feeling, and go here and type in a word and send it to us. And these questions were actually created and put together before the social injustices that we have recently been seeing. So your feelings here can reflect not only COVID-19, but the social challenges that we're addressing as well. So the more times a word is used, the bigger it is. So stressed is jumping out at us, scared, anxious, disoriented, worried, overwhelmed. So all these feelings that we're having are all normal feelings. We would be odd if in the circumstances and days that we're living in, we didn't feel many of these things. And for those of you who are living with mental illness or family members, you see this amplified. And I can only imagine how the physical separation and isolation has made life even more challenging. So I hope that we're able to save this word cloud. I think it says a lot about where we are and the supports that we need to be providing for each other to be able to get through this time. Thank you for participating. We'll go to the next slide. So some of the responses that the Department of Healthcare Services have had to COVID-19 can be summarized in trying to really think about flexibility and providing a more dynamic support for the field. We cannot do things the way that we have always done them and be successful. So really the infusion of telehealth and creating more flexibility for people and programs to do that, making provider enrollment easier, licensing, doing virtual background checks, all the things that we normally put up as hoops that people have to jump through. We needed to turn the enterprise much more quickly and be much more responsive. And out of this pandemic, we hope that there'll be some good things that will remain even after some of the executive order and waivers go, that we will be able to suggest that some of these things should be continued forward. And we'll go to the next slide. So some of the other things, again, taking a look at audits. We spend a lot of time going out and looking at programs, doing those virtually or postponing them. Taking a look at making it easier to get providers on board, giving some flexibility to our driving under the influence programs, taking a look at larger doses or more doses for people who are doing outpatient. Taking a look at, you can't get some of the education done and the training done, so extending certification timelines and creating some flexibility in our payment processes and also how we document things. Our physical separation has created many challenges that we've had to find solutions for, but while we have been physically separated, we are working to maintain our social connectedness to each other. So we'll go to our next slide. And the iceberg's just a great image and analogy for what we're experiencing now and what we've experienced since March 15th is really just the tip of the iceberg. We are just learning about what COVID-19 is going to do, how it moves through communities. We've done a really good job of flattening the curve, but while flattening the curve, we created other issues as well, which we will have to recover from. So it was a great debate and balancing act between the public health and the economic health. And we are now going to be trying to work through both of those. There are many things that are still in front of us that we need to figure out. And what we've learned so far is just barely above the surface. And if we think about that USS Enterprise, we may see the iceberg ahead, but we don't want to become the Titanic. We want to make sure that we are working together and finding solutions that support people. And if we go to the next slide, I think I can tell one more story and then we can get into some questions. And it's a picture of the Earth, and it's a story about Johnny and his dad. And his dad is sitting there reading a newspaper, trying to relax, though reading the newspaper today isn't necessarily relaxing. And Johnny wants to play and comes up to Dad and pulls on his pant leg and says, "Dad, let's play." And Dad says, "No, I just need a little bit of time to relax, so I'm just going to read for a little bit." So Johnny goes away and then comes back again, and same question, and Dad says, "Okay, tell you what I'll do." So he takes the back page of USA Today, and the picture of the Earth is on it, tears it up into tiny little pieces and gives it to Johnny and said, "Here's a puzzle for you. Johnny, go take care and put this puzzle together and come back. And when you do, we'll play." Dad thinks he's got a good hour or more because he tore it in little pieces. But amazingly, in just about 5 minutes or so, Johnny's back. And Dad thinks, "My son's a genius. Look at how well he knows geography." Well, Johnny says, "I'm not too good at geography," but the next slide shows that on the other side of that piece of paper was a picture of a family. And when I put the family together, the world took care of itself. And that's what we're doing, is that by the work that we do on helping individuals, our communities begin to heal and the world will begin to heal. So if we go to our next slide. During this time, as hard as it's been, are there any positive things that have come out of COVID-19? So this is a chance for another word cloud, something positive that may have come out of your experience over the last month that you've learned, you've experienced. Yeah, Zoom, self-care, good. What other kinds of things have come out of it? Slowing down, clarity, being able to readjust, more family, stronger than you realized, yes. Connections through new channels, really connecting with your son. Actually, more connections despite the physical distancing. More quality family time. Learning to cook. What's for dinner tonight? Should we come over? We'll wait and see what comes up. People joining together. Focus on priorities. Faith. Joining together in unique ways. You're zoomed out. I know that feeling. Ability to focus on fitness. I actually bought a spin bike at home here, yeah. Growing outreach using innovative methods. One can find positive moments during hard times, yes. Communities of help that we didn't even know exist. We have 2 that are zoomed out. Spaghetti, maybe, okay. For dinner. Connecting by phone with many people. It's funny, you know, we found out that those things that we have, you can actually talk on them as well. The phone, it does more than just texting and Facebook. You can actually talk into these things. Slowing down and learning to live with less busy time, being bored, helping others, finding some unity, knowing how lucky we are, viewing some old problems in new ways. FaceTime is becoming family connection, helping others more, focusing on priorities. Well, these are all great reflections, and seeing that even in the most challenging and darkest of times, the resiliency that we have when we work with each other, and you know this better than most, it is by supporting each other that we find our way through challenging times. So again, I hope that we're able to capture and save all these and share these. I think particularly these positive things that have come out of COVID-19 are good things to remind us. Somebody earned a second college degree. Congratulations. So I think we have just maybe one more slide, and this is a audience participation opportunity. So what I'd like you to do now is you all have a screen in front of you. What I'd like you to do is actually put your finger on the number 12. Okay. And now pick any number from 1 to 12. Doesn't matter what number it is, you can pick any number. And what you're going to do is, starting at the number 12, you're going to spell the number that you chose one letter at a time. So for example, if I chose the number 1, I would start on 12 and I would go O-N-E, and I would be on the number 3. So go ahead and do that. So whatever number you chose, spell it out going clockwise, and your finger's now on a new number. Whatever number you are on now, do that again. Spell that number going clockwise, and you'll find your finger on yet another number. Now, one last time, whatever number you are on, spell it going clockwise. And leave your finger right there. And as we think about all the inequities that we see in race, in economics, the one thing that is equal for all of us is time. It's the only thing we all have exactly the same amount of. And what we do with it is up to us. And if we all did just what we followed, and I believe that every one of us right now, no matter where we started, are ending up together with our finger on the number 1. And as that number 1 reminds us that each one of us is important, and each one of us has the ability to make things better. So I hope that you remember the one to do something, to stand up, and to be the one to make the world a better place because of what we do together. So that is my kind of presentation to open up our town hall. I apologize that my camera has refused to load up, but you have my email address there, and I welcome any emails from you. jim.cooler@dhcs.ca.gov. And I would be eager to try and answer any questions, and either if we do them by chat or if we're opening up the lines, however you like to work this. Angela, Jessica, thank you for the chance to be a part of this.
Thank you so much, Jim. I really enjoyed the integrated polling, really feeling hopeful after that last slide, and definitely want to second your congratulations to the person who got their second college degree. And kind of looking through the responses, there was another one that stuck out, which was the person who shared that they were disabled and in a wheelchair, and that the way that we're sort of, doing our standard operations now has allowed them to participate in our virtual meetings. And I think, that's a lot of, we talk about some of the negative unintended consequences. And I've shared with a lot of folks throughout this that, we see this integration of, technology and Zoom and GoToMeeting and all of these platforms as a way to add to our ability to connect with folks, knowing that geography and physical limitations and loved ones at home, there's a number of reasons that, folks can't always get to a physical meeting or physical event. And so I'm inspired and encouraged that, while we're all feeling a little zoomed out, that, over time, we'll be able to touch more and more folks by adding these types of events to, our sort of standard business practices. So, so we've got up on the screen now the Q&A session, not rules, but guidance. If you want to ask a question, make a comment, how to raise your hand. Our staff here, Brianna, one of our team members, is going to kind of help with muting and unmuting. But just as a reminder, when you're unmuted on our end, we also want to make sure you're unmuted on your end. So make sure on the side you check off your microphone so that we can hear you. And we'll go ahead and start with, we'll start with that. I'll turn it over to you, Brianna, if there's anyone in the queue that has a hand raised.
Thank you, Angela. And thank you so much, Jim, for that presentation. We appreciate it. So we're excited to hear from some folks. Douglas, I see that your hand is raised. I'm going to go ahead and unmute you now.
Thank you very much, Dr. Cooler.
Hi, Douglas.
Very good presentation. I have a question, and if this is beyond your area of expertise, just tell me and we can get an answer differently. A lot of the state has filed for a lot of COVID-19 waivers.
Yes.
With CMS in Washington. I'm particularly interested because of the situation of our mentally ill loved one in section, what they call 1115 and 1915. We understood the state has filed, but that they haven't gotten a reply back from the federal government. Is that still true as of today?
It is true on a number of levels. There have been a lot of 1115 with different letters after them that have been approved and some that have not. On the DHCS website, there is a section that shows all of the waivers that have been submitted and which ones have been approved. And it is a really deep and complex grid that is beyond my expertise, coming from the world that I came from. But in listening to my team and the folks that I work with, the number of hours they work talking to CMS to get flexibility to make services easier is enormous. And yet not everything we ask for we get. So if you have any specific questions, I'd be happy to send me an email and I will see if I can't get you connected and answer the specific question.
Will do. Thank you very much.
Great. Thank you.
Thank you, Douglas. I'll go ahead and mute you again. So we don't have any additional hands raised at this time, but we do have some coming through the chat box.
Great.
So I'll go ahead and start with some of these. My main question is, how can I get my local hospital to add more psychiatric and counseling services? This is a rural community of about 28,000 people.
So from the DHCS standpoint, we don't necessarily manage the hospitals, but we work with the county behavioral health departments. So if we know what county, we can assist in making the connection to the behavioral health departments and the managed health plans, the managed behavioral health plans that are available in that county. The dance between the mental health plans and the counties is always an interesting one, unfortunately. So I don't have a great answer on how to get more services within that specific hospital. But again, if we, in the chat box or an email, I would be happy to connect folks in that county to talk about that specific hospital and what we could do to support services there.
Great, thank you, Jim. And I did just want to note to everyone listening in on the call, we did type in Jim's email, and so we submitted that. It's through the chat box to everyone, so you'll be able to copy and paste his email from there. Another question coming through on the chat box: will DHCS continue to pay for telehealth for Medi-Cal visits with therapists and doctors?
We certainly intend to do that within the regulations that we have to work in. So there are certain pieces that we like very much that we now have waivers for that we would like to continue. The ability to do that, we are still working to figure out how best to do that, whether we have to get a permanent waiver from the Center for Medicaid Services, or whether it's something in our state regulations that we have to change. But the demonstration on the effectiveness of telehealth has catapulted us into new delivery models that we think have been effective that we would like to continue.
Thank you, Jim.
Sure.
Another question in the chat box is, how do we know our loved ones are being taken care of if we cannot visit them in psych nursing homes? Any extra inspections? Do they have proper PPE? My elder mom with schizophrenia was placed in quarantine yesterday for COVID exposure.
I'm so sorry to hear that. And the availability of the personal protection equipment, the PPE, has been a priority to make that available. And it is unfortunate that the congregate housing settings are the places that seem to be the most risky for the transmission of COVID. And the restrictions being put in place to protect both the people who are there and the staff make it very difficult for families who want to be close to their loved ones. And there isn't anything I can say that will make this situation any better, other than I understand the pain and the challenge, but I don't have a good answer, I'm afraid.
Thank you, Jim, and thank you so much for that question. I do have someone who's raising their hand. Rowena, I'm going to go ahead and unmute you.
Hi, Jim. I have a son who's in a state hospital at the time, and my concern is during this COVID-19, I have not been able to visit with him. I know they're in quarantine, but in my speaking with him, I've asked him how things are going, and one of the things that he has disclosed to me is that they're not cleaning, sanitizing. There is no the stipulation of the social distancing, no mask. So I'm concerned about what's going on. Is there anyone overseeing the state hospitals?
Thank you, Rowena. I'm sorry about the conditions that are going on there. The state hospitals are not part of Department of Healthcare Services area, but I can certainly find and connect with the
But
department.
I'm sorry to interject, but he
No,
has
please.
a mental illness. So we can't do anything there?
I don't know the process, but I'm happy to check with our folks who know more about the mental health hospitals and their management and the support that is going on there.
Right.
So Rowena, I'm sorry I don't have.
You know what? I've been asking this questions for about 2 years, and I'm not getting anywhere with no one.
Well, let me send me the email, and let's see if I can make any traction for you to at least get some answers.
Thank you. I appreciate that.
Thank you.
Thank you both. Rowena, I'm going to go ahead and mute you again. All right. We have some additional questions coming in through the chat.
Great.
Sorry about that. Just going to scroll down. We're getting quite a few, so I'm a little
Good.
backed up. Okay, so someone is asking, do you happen to know the status? She understands there is a bill floating around in Congress that would allow Medicare payments to licensed family therapists.
I'm not familiar with the legislation or where it stands, unfortunately.
Got it. Thank you, Jim. I'll go ahead and mark this one, Lana, and we'll see if our team here at NAMI California can get back to you on that.
Between us, we can do some research and figure out where that is.
Great.
Let's bring on some more questions I can't answer. I'm really good at this.
All right. Okay, scrolling down. Okay, another question, comment and question. I really appreciated you mentioning the statewide peer support warm line. Any suggestions for peers being able to have more meaningful input with local county behavioral health administration and management?
Great question. There is California legislation going forward to formalize the role of peers in the treatment delivery system. So that is in the works. The other is for the CalHOPE work that we will be doing, which again, that's an application to FEMA. It isn't here yet. We're looking to that as a project that is ideal for peers, and we will be asking counties to engage and recruit peers to be the crisis counselors, and the training for that is in hours, not in months and years, to be able to do that kind of work. So the value of peers we greatly appreciate. In my history in working in youth developments, peers were critical. Young people listen to other young people more than they listen to others. And that is, I believe, true in the world of peer treatment as well, is that those who have lived experience and have persevered and have found a pathway forward are great role models and can help others follow in their footsteps. So we're very supportive of peer models and trying to find ways to make that a truly valuable and honored, respected part of our system.
Thank you, Jim.
So, thanks for throwing one my way. I could answer a little bit. That was good.
All right, Elaine, I see that your hand is up. Elaine Rohr, I'm going to go ahead and unmute you.
Hi.
Hi, Elaine.
I was unable to join the webinar at the beginning, so I joined by telephone, but then the telephone line went dead, so I had my husband help me get online. And my question is, I wanted to be able to contact CalHOPE, but I don't have the address, the web address.
You can find us at calhope.dhcs.ca.gov, G-O-V. So that would take you to our website, calhope.dhcs.ca.gov, and you'll find some resources there and the phone number to be able to connect with the peer warm line.
Okay, I have the phone number for the warm line. Let me just repeat back to you because I can't see the web address. Let me repeat it back to you, see if I got it right. I have CalHOPE dhcs.ca.gov.
And there's a dot between CalHOPE and DHCS.
Okay, thank you very much.
Great, thank you.
Thank you, Elaine.
Thank you to your husband for helping us.
Yes, definitely. Thank you. And I also went ahead and typed that into the chat box so you all can copy and paste that as well from there. All right, we have additional ones in the chat box. No hands up at this time. Another comment and question. We spoke of negative and positive effects of COVID and the additional crises that follow. The stress, fear, isolation, and unemployment effects on mental health are obviously some of the negative effects. But the change in tone and conversation about mental health and mental illness from the back of the room to the forefront and as affecting a fringe group to affecting us is all positive. How do we keep that conversation going and continue to prioritize mental health and mental illness in terms of continued funding and support of DHCS?
What wonderful language and bringing the conversation from the back of the room to the front. It really feels like this is a time when behavioral health issues are becoming easier to talk about. And I think we are fortunate to have a governor and a health secretary. And if you've had a chance to listen or see Dr. Burke Harris, our Surgeon General, they are all very committed to health and well-being, and that includes mental health as well. So I think we are fortunate to be in an administration that believes that these things are important and that the work that we are doing is valued. So if you were ever to visit the covid19.ca.gov site, you will see that there is a significant amount of space dedicated to mental well-being. So how do we keep it? Well, we keep it by staying in the forefront and staying in the conversation. This is a disaster which isn't going to go away in the short term, and the behavioral health issues are going to last months or years after the physical health issues have been taken care of. So our commitment is to stay on top of this, and the things that we put in place for CalHOPE, while intended for the immediate disaster, we think are things that will need to be continued long after the declaration of the emergency for health issues has been set aside. Our sense is that there is a wave of deaths of despair that will wash over us if we don't address the behavioral health issues that are swelling up inside. So your advocacy as NAMI, your voice in making sure the Department of Healthcare Services remembers this, your advocacy with legislators, all the things that NAMI normally does have become increasingly important during this time to hold us accountable and remind us that we have to keep working on these issues. So I think the key is be loud, be proud, and continue to do what you do best.
Thank you, Jim. And thanks for that question, Ali. Another question popping up in the chat box. What are the plans helping tribal communities?
Great question. With the crisis counseling program, tribes were eligible to apply directly for support from FEMA and SAMHSA. So we did what we could to push information out to them and allow them to apply directly and not have to work through the state if they chose not to. We also built into the request for the regular services program, the one that we hope to be getting, we built in money to do a contract with Sakui, which is an urban Indian population contractor that supports health in the urban areas. So we will be, if we're successful, contracting with them to be able to provide support. And while their focus is on urban communities, it will not be limited to that. It will be available to others as well. Any of the tribal communities are always welcome to take and access the existing services, but things specifically for them right now are those applications we're going for, applications they may have gone for. So we are eager to do the right thing and support tribal communities.
Thank you, Jim.
You bet. Thank you.
We have someone raising their hand. Michael Lim, you're unmuted.
Hi, Jim. Thanks for your time in doing the presentation for us. I am really heartened to hear that you're expressing your value that you see in peer support services. During this COVID-19 situation in my county, the first group of people that really jumped to provide services to our peers are the peer support service organizations, and through them, we were able to reach out to a lot of people that want to couldn't because of their situation. So my question for you is, firstly, I understand you mentioned that there's some piece of legislation going through the state. I think it's SB 10 that's for peer support certification, and that it will require DHCS to be running the program in terms of requirements for the certification. So my two-part question is, firstly, can we count on DHCS support to push that through? And secondly, also is that one of the things that is, I would say, a barrier for us to do peer support in current times is that some of our peers, because of financial difficulties and things like that, do not have the technical equipment so that we can reach out to them. Is there support from the state with regards to that, so that the county's budget, which is already stressed, are not stressed further?
Michael, thank you for the question. I had a little trouble hearing, so if I don't answer the right question, please ask again. But one of the things I heard was about, can we count on DHCS's support for the peer bill? The way the support works within government is that any of the government agencies can't take a position on any legislation without the governor already taking a position. So at this point, I can't give you any feedback on where DHCS will land in support or opposition, just because the process doesn't allow that. What I can speak to are some of the principles that might be applicable when looking at the legislation. One is that we believe peers provide valuable support. We believe that having sets of standards and qualifications are beneficial to a field. When we think about what DHCS does well and doesn't do well, we're not really in the business of licensing individuals, we license programs. So those are kind of principles you can think about when you think about where DHCS might land in thinking about the particular legislation that is going through the process. We also try and always take a look at what are the opportunities to implement principles of bills within our existing authority. So there may be things that we can do in support of peers that may not even take legislation. So that kind of work is going on. And it sounds like there was also a question regarding personal protection equipment for peers and not being able to access those. And I don't have much information on that, other than the counties are the ones who are managing that equipment more than the states.
No, not personal protection equipment. I meant technical equipment, like phones that you can access through Zoom. So that,
phones, so technical equipment. And that unfortunately is more of a local issue than a state issue. That is within the county's authority to use and their funding to buy the equipment. Their budgets, as everyone's budgets, are not in a very good position right now. If people become involved with the CalHOPE project and we're funded through FEMA, we acknowledged and built into that resources to be able to provide phones and hotspots and computers for people that will be doing the crisis counseling. So it doesn't help with the immediate issue, but that's, should we be funded by FEMA, we acknowledge that's a part of what is necessary to do the work.
So currently there is no federal or state funding to provide that. So currently the responsibility falls on the county.
It falls on the county. There was a small grant program from the Federal Communications Commission for telecommunications, but I think that came and went so quickly, no one even had a chance to really apply for it.
Well, thank you for the clarification. I really appreciate it.
Thank you for the question.
Thank you, Michael. Okay, Rowena, I do still see your hand up, and I'm not sure if that's just from earlier. So I'm going to go ahead and mute you. Feel free to just let me know if you don't want to. I'm going to take that as a no.
But I'll raise my hand and wave back.
There you go.
Yeah.
Okay. We do have a couple more questions coming through in the chat box.
Wonderful.
Does DHCS have policies that support an increase in psychiatric services that are diminishing? And if so, what are they?
I don't think we have a policy that promotes specific services. We have, through Medi-Cal, an array of services that can be funded. And it's really, for the most part, in the county's hands which services they will provide and bill us for. So it isn't so much that the state is dictating the services, but we set the codes and we do the reimbursements, and the delivery of services and the array of services, while there's some consistency, is more locally driven. So unfortunately, a rather unsatisfactory answer to that great question.
Thank you, Jim.
Sure.
All right. And I do have some questions popping up in the chat box. The session is recorded, and so we will be sending that as a follow-up.
Great.
All right. I'm not seeing any new questions pop up in the chat box. I do have a comment from someone. Oh, I lost it. Here it is. Just a comment, more tech hardware is needed to get into the hands of underserved populations. Phone companies should be encouraged to donate some internet time to these same populations.
Agreed.
Oh, and as a follow-up to that same comment, suggestions on hardware or phones, schools and universities could all donate outdated hardware to underserved populations. I am using an outdated Toshiba to attend all of these meetings donated to me by an elementary school. Awesome.
Oh, great. And if you have a connection to youth in the foster care system, there is a program called iFoster that is providing cell phones and hotspots to young people in the foster care system. So they were able to find a way to get resource to be able to make technology available to youth in the foster care system. So there is an example and a demonstration that it can be done.
Great, thank you, Jim. I do have someone else with their hand raised. I'm not sure how to pronounce it. Lael?
Okay. Lael, thank you. Very well.
Great. Awesome. Go ahead, please.
I actually asked the question about there's a shortage of psychiatry statewide, so I just didn't know if the department had any strategies in place to improve that so that our local level have more opportunity to get more psychiatric services.
Lael, thanks for the question. I'm not aware from where I sit of much of that going on, but I can check with our medical director and see if there are things going on outside of my area that are moving in that direction. Some of the things that I have seen are trying to provide opportunities for psychiatric nurses to be able to do more of what they do to fill some of those gaps, but that's not the same as having a psychiatrist on site.
Well, and I would support psychiatric nurses. There's just a shortage overall of psychiatric level credentialed personnel, and it's going down. I guess that's our concern. And so there just doesn't seem to be a lot of people wanting to be psychiatrists or psychiatric nurse practitioners to support our clientele, our loved ones.
Right. Great question, Lael. I will connect with Dr. Karen Mark, our medical director, and see if there's anything going on in that area.
Thank you so much.
Communicate back to Angela, or if you want to send me a note, I will communicate back to you directly, whatever you would like.
Thank you very much.
Of course.
Thank you, Lael. All right. I don't see any additional questions or comments or hands up. Oh, actually, one just came in. Please post info for foster care. Jim, you said that was iFoster. Is it .org, .com? Is it on a website?
Let me see if I can bring that up. It should be, it's just ifoster.org, but let's double check and make sure.
Great.
And I can send you an email with the right info if that's not right.
Okay.
ifoster.org. And it helps if you spell it right. Yes, that will work. So it's just ifoster.org, www in front of it.
Okay, great. Thank you, Jim. I'll post it to the chat box right now.
Great, thank you. Well, again, we really at Department of Healthcare Services value greatly the work that NAMI does and the opportunity to meet with your leadership on a regular basis. The chance to be a part of this town hall today was a great joy for me. I'm lucky that the camera was not on because I'm sweating a lot by all these great questions. So in some cases, it's a blessing you didn't get to see me sweat, but you got to hear it.
Thanks, Jim. And again, just to echo Jim and the rest of the NAMI team, we wanted to thank everyone for joining us today. We do have up on this last screen here, there's some information. I know Jim shared his email address. My email address is also available for folks who have any follow-up thoughts, questions, as well as an evaluation on your experience with us today. I will send out after today's meeting, this is being recorded. We have some really great comments in the chat box, links to iFoster, links to the CalHOPE website, as well as our evaluation survey on today. So look for an email from me with a link to this recording, the materials presented, and follow-up information, including these websites and phone numbers, so that you can either have for yourself, or if there was someone that you knew that wanted to join today that couldn't, you can make that available to them, as well as any other thoughts or comments or questions that kind of come in for you over the next few days. So I'm just going to close out by saying thank you so much for joining us all here today. Thank you for your thoughts, your questions, your comments, for sharing your feedback during our polling questions. We really just appreciate everything that you all have brought to the table today. And again, a special thank you to you, Jim, for sharing the information about what you all are doing at DHCS and really being available to families across the state for this conversation. So thank you to everyone. I hope that you all are doing well, that you stay well, stay safe, and stay healthy, and we'll see you next time.
Thank you. Bye.